What do you do? What's your hobby? What do you do for fun?
Motorcycle, snowmobiling, water sports.
Yeah, all the fun stuff.
Yeah.
But you couldn't do that before our surgery for a while.
Very limited amounts.
Tell me about that.
A motorcycle, you could ride maybe 30 miles and I would have to get off because my back would start aching really bad.
Yeah.
Snowmobile.
How bad was the pain then when you would do that?
It would get to the point where my legs would go numb.
You had to stop.
I had to stop.
Okay.
Sometimes I couldn't feel the brake pedal. I knew my foot was there, but I couldn't feel it.
Okay, okay. You had previous surgery that was not a fusion, it was just decompression, which is considered smaller surgery.
Yes.
Without telling the names, what was the result of that surgery and when was it?
In 2018.
Okay, so
and the doctor said that it would last maybe a year, year and a half, because I had severe compression back there.
Yeah.
And it lasted about 18 months, and it started to ache more and more.
Yeah.
And that's...
How bad was the pain before the surgery, before our surgery? When it
wasn't so much pain, it would just ache really bad.
All the time, okay.
Yes, yes.
Now, the surgery was just 4 months ago.
Yes.
And this is what we did. We did a L4 to S1 fusion. Literally, we put spaces in, what beautifully starting to grow. The screws are all in a good place. And actually, bone as well start to grow in the back. Look at that right there. And here's the front view of that. How long did you stay in the hospital?
One overnight.
Just one night?
Yep.
And before the surgery, did you have leg pain?
Yes.
When did the leg pain go away?
Almost immediately.
Almost immediately?
Yep.
And the back pain, how bad is it now?
Walking, it just gets sore after probably 15 minutes.
Yeah.
Doesn't really hurt, it just gets sore.
Yeah, my assistant is telling me the pain is now 1 of 10.
Yeah.
Is it?
And if I wear the back brace, it does feel better longer.
Yeah. Now it comes to the real question. When did you go back to biking? Tell me about it. How
2 months after the surgery.
2 months after surgery. How did it go?
When I drove out of the driveway, you've got your little bit of curb height.
Yeah.
There was a little bit when that hit, that...
You felt it?
Felt it. It's like, well, you're not quite ready for this, the body did. But I did go put 10 miles on, and it was good.
Yeah.
Felt great.
Yeah, for you did some research before you came to us.
Yes.
Now, what did you find? What made you come to us and not to go to get open old-fashioned surgery?
Curtis Hovde had it done.
Yeah.
And he's a big man and said that his pain was just about nothing.
Yeah.
And I had just the minimal invasive part of it.
Yeah. Actually, he's in the next room. I'm seeing him. But tell me, what would you say if you're it's a theoretical question. Obviously, you are in a good path. What would you say if your insurance would tell you you have to live with the pain, number one? That there is nothing, that they wouldn't, if your insurance wouldn't approve this surgery for you? Because this happened to some people. Thankfully, it didn't happen to you. But what if your insurance would say you have to live with it? What would you tell them?
You'd have to decide if it's that bad to where you'd have to sacrifice something else, or have to go to the bank or something, do something if it's that bad. Yeah.
Now, as well, sometimes insurance say that they only pay for open surgery, where we cut you open, literally fillet you open, versus our surgery, because if you remember, you said you went home next day.
Yes.
After open surgery, you don't go home next day. And again, your insurance didn't give us any trouble in regarding that, but if it would, what would you tell to your insurance if they would tell you you can only get the open old-fashioned surgery, not the minimal invasive surgery?
I guess if that's the way it has to be, that's the way it has to be. But then you'd have to figure out if you have the time available to take off work, then it's going to take you to heal. Yeah,
I'm telling you that because actually your insurance is health partner, right?
Yes.
They just told us if you don't cut you open, if you don't fillet you open, we cannot do this surgery anymore.
Really?
So yeah, next year I could not have done this surgery for you. I only could have done an open old-fashioned surgery for you.
Isn't the fillet surgery going to cost more money than the minimal invasive surgery?
Overall, it does. We have a paper that shows that it does cost more.
So that makes no sense.
That makes no sense.
For them as being...
Yeah. Now, is there anything, you want to let them know about your problem that you went through? about your recovery, about your situation. Is there anything you want to tell them about to help partner? Because
other than the fact that they're going to have a lot more people are going to be out of work longer.
Yeah.
And it's going to cost them more money. If it's going to cost more money for you to do the surgery, it's going to be a longer hospital stay.
Yeah.
So it's going to cost them more money in the long run. So that doesn't seem financially smart to me.
Yeah, and you know, and we have a track record of that. We have a track record of 1,400 patient recover faster. Our blood loss is 1/10 of the open surgery. Our infection rate is 1/30th of the open surgery. And it is to me baffling that they say you have to do open old-fashioned surgery. So, but you are one of their patients telling here you stayed one night in the hospital and 2 months later you are returning to your life.